Most mornings usually start the same for us. We take Chester for a walk, we go to work. I mean, it's that simple. I started teaching at the university level, and I taught for 10 years as a professor of polymer science. And then at that point, I moved to industry, and I love what I do. Several years ago, I had one symptom, and that was blood in my urine.
I said, that is not normal. That's not good. We've got to get you into a doctor.
The urologist said we have to do further testing, and that was when she said, George, you have renal cell carcinoma.
The urologist scheduled George with a oncologist surgeon, and we went and saw the surgeon, and he scheduled more tests and then scheduled surgery and removed his right kidney.
They told me I should be cancer-free, so I went on with my life and didn't give it much thought. I went back to the doctor later in the year, and at first when the doctor looked at it, he said everything's fine. But then a few minutes later, he said, oops, we have a problem here because this thing has metastasized to your lungs. I asked him, what does that mean? And he said, well, it's basically incurable. At this point, the best we can do is to control it. The oncologist said, George, we think we can help you, maybe. And he said, what we'll need to do, or what we'd like to do, is to have you participate in some clinical trials. The side effects I experienced on the first few clinical trials were just too much for me to handle. They were bad enough that they interfered with my work and my daily life. And worst of all, my cancer did not respond to most of the treatments.
When George was pretty sick, I did feel like I was giving up hope that he wasn't going to be around. Our grandson lived with us, and he wanted to see him through Eagle Scout and graduation. And I was so afraid that he wasn't going to have those opportunities.
Fortunately, my doctor told me there was one additional clinical trial available, and it was for a treatment now known as FOTIVDA. Taking FOTIVDA was straightforward. FOTIVDA was a pill I took once a day in the morning along with other medications. When I started taking FOTIVDA, I had a CAT scan after 60 days, and the cancer had shrunk. Then at 120 days, I had another CAT scan, and the cancer had shrunk further. That was very exciting news. It was, I would say it was almost unexpected, but it was very wonderful news. So my current situation is that the tumors are still there, but since taking FOTIVDA, they have not grown. I want to keep living, keep being active, being involved with church, with family, with businesses, with friends. So that's what we really think is important. I would say to those who out there who feel the world's against you, my advice is don't give up, keep trying, be positive.
If we could help one person, then it just makes it all worth it.
If you have advanced kidney cancer, I would encourage people to talk to your doctor and see if FOTIVDA is right for you.
Indications and important safety information. FOTIVDA, tivozanib, is a prescription medicine used to treat adults with advanced kidney cancer, advanced renal cell carcinoma, or RCC, that has been treated with 2 or more prior medicines and has come back or did not respond to treatment. It is not known if FOTIVDA is safe and effective in children. Possible serious side effects can occur with FOTIVDA. Call or see your healthcare provider right away if you develop High blood pressure, hypertension. High blood pressure may be severe, including a sudden severe increase in your blood pressure, hypertensive crisis, that can lead to death. Your healthcare provider should check your blood pressure after 2 weeks and at least monthly, and may prescribe medicine to treat high blood pressure. You should check your blood pressure regularly and tell your healthcare provider if you have increased blood pressure or experience confusion, headaches, dizziness, chest pain, or shortness of breath. Heart failure. Heart failure may be serious and sometimes lead to death. Your healthcare provider should check for symptoms of heart failure regularly, such as shortness of breath or swelling of your ankles. Heart attack and blood clots in your veins or arteries. Blood clots may be serious and sometimes lead to death. Tell your healthcare provider or get emergency medical help right away if you have new chest pain or pressure, numbness or weakness on one side of your body, pain in your arms, back, neck, or jaw, trouble talking, shortness of breath, sudden severe headache, vision changes, swelling in the arms or legs, bleeding problems. Bleeding may be serious and sometimes lead to death. Report or get medical help right away if you have unusual bleeding from the gums, red or black stools, looks like tar, menstrual bleeding or vaginal bleeding that is heavier than normal, bruises that happen without a known cause or get larger, headaches, feeling dizzy or weak, bleeding that is severe or you cannot control, coughing up blood or blood clots, pink or brown urine, vomiting blood or your vomit looks like coffee grounds, unexpected pain, swelling, or joint pain. Protein in your urine. Your healthcare provider should check your urine for protein before and during treatment. Thyroid gland problems. Your healthcare provider should do blood tests to check your thyroid gland function before and during your treatment, and may prescribe medicine if you develop thyroid gland problems. Risk of wound healing problems. Wounds may not heal properly during treatment. Tell your healthcare provider if you plan to have surgery before starting or during treatment, including dental surgery. You should stop taking FOTIVDA at least 24 days before planned surgery. Your healthcare provider should tell you when you may start taking FOTIVDA again after surgery. Reversible posterior leukoencephalopathy syndrome, RPLS. RPLS is a condition that can happen. Tell your healthcare provider right away if you have headaches, seizures, confusion, blindness, or changes in vision, or difficulty thinking. Allergic reactions to tartrazine, FD&C yellow number 5. FOTIVDA contains a dye called FD&C yellow number 5, tartrazine, that may cause allergic-type reactions, including bronchial asthma, in certain people. This occurs most often in people who are also allergic to aspirin. The most common side effects of FOTIVDA include tiredness, diarrhea, decreased appetite, nausea, hoarseness, low levels of thyroid hormones, cough, mouth sores, decreased blood levels of salt, sodium, and phosphate, increased levels of lipase in the blood. Other side effects include vomiting and weakness or lack of energy. FOTIVDA may cause fertility problems in males and females, which may affect your ability to have a child. Your healthcare provider may change your dose, temporarily stop, or permanently stop treatment with FOTIVDA if you have certain side effects. These are not all of the possible side effects of FOTIVDA. Before taking FOTIVDA, tell your healthcare provider about all your medical conditions, including if you have high blood pressure, have a history of heart failure, have a history of blood clots in your veins or arteries, types of blood vessels, including stroke, heart attack, or change in vision, have bleeding problems, have thyroid problems, have liver problems, have an unhealed wound, plan to have surgery or have had recent surgery, including dental surgery. You should stop taking FOTIVDA at least 24 days before planned surgery. Are allergic to FD&C yellow number 5, tartrazine, or aspirin. Are pregnant or plan to become pregnant. FOTIVDA can harm your unborn baby. If you are able to become pregnant, your healthcare provider should do a pregnancy test before you start treatment. Use effective birth control, contraception, during treatment, and for 1 month after your last dose. Talk to your healthcare provider about birth control methods that may be right for you. Tell your healthcare provider right away if you become pregnant or think you might be pregnant. Tell your healthcare provider about all the medicine you take and any new medicine, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking FOTIVDA with certain other medicines may affect how FOTIVDA works. Please see the patient information in the full prescribing information for FOTIVDA tivozanib.